The other area that is emerging as an important area, there are two other health effects associated with pollutants, both of which involve changes in innate immunity or inflammation that are growing in concern. One is that air pollutants cause cardiovascular disease as well. So there's actually impact on vascular disease. Much of that, not all, but much of that is due to increased vascular inflammation and those sorts of responses. The second thing is that air pollutants appear to be having effects on host defense, or the ability to fight infections. Particulates have been shown both experimentally, and there's some data that suggests that bronchitis is worse after exposure to, say, wood smoke particles after a wildfire. So that's a problem that we're beginning to look at, both, as a professional society and as specific laboratories, including ours. The other area of interest that will get a substantial amount of attention, and I expect over the next 2 to 3 years we'll be seeing a lot of information about this, is the effect of cook stoves. So people who use wood or other biological sources of fuel, dung, peat, coal, so-called biomass combustion, the particles that come from that are oftentimes really problematic, and people who use those fuels usually live in areas and in homes where it's not terribly well ventilated. This is perhaps the United Nations and the World Health Organization have commented that this may be one of the leading causes of COPD in the world, second only to tobacco use in the developed world. So it is a very significant problem. In children who live in these kinds of environments, one of the things that they routinely get is increased lower respiratory tract infections or real pneumonias and bronchitis. In our laboratory, we find that after exposure to pollutants, response to experimental viral infection is, using the fluminous vaccine as a surrogate model, is modified and changed. So we believe that air pollution is important in 3 major areas. One, it's important with regards to impact on asthma and atopy, which have been a classic focus of our specialty. 2, the inflammatory effects of pollutants on the cardiovascular system and systemic inflammation are increasingly recognized because we as a specialty deal with processes of inflammation. That should be of concern to us. And third, there are very likely effects of air pollutants on host defense and likelihood for infection. That both directly impacts risk for asthma, because most asthma exacerbations are caused by viral infections, but just on a broader scope, that's an important problem. What we may be doing is actually making devices that would make it possible for people to know what they're being exposed to, and maybe modifying activities. I think the big issues are really the following. I don't think we should get to a point where we're all wearing masks. I think what we should be doing is thinking about what alternative fuel sources should we be using. So people, and while I spoke about the third world, there are plenty of places in the United States of America where people use biomass fuel either recreationally or out of necessity. The rural West, mountain states, so you mentioned Montana. Many people in Montana, particularly the rural poor, use wood a lot, and that's a big biomass source, and wood smoke is actually a pretty potent irritant. I would argue that many of the wildfire issues we see probably are due, at least in part, to change, to how we as a country use water. And if it's drier where there are trees, the likelihood of having poorly controlled fires is increased. We may want to think about, as large groups of people, where we live so that we don't overstress those areas. And finally, I think that we need to think about what the standards for clean air actually are. And if we provide reliable proof that certain levels of pollutants really are problematic, it's incumbent upon our policymakers to decide what trade-offs we make. Do we have more stringent clean air rules about automobile exhaust, about factory exhaust, about zoning and where you put residences? Some of these solutions take a long time to implement, but they begin by knowing what the problem is and knowing what the risks are.